bariatric surgery.
Yes.
If you were to break it down and just describe it to a layman, how would you describe it?
Now, see, first thing I want to make a clear difference between cosmetic surgery and bariatric surgery.
Okay.
These two are different things. So the cosmetic surgeries are usually done by plastic surgeons. Bariatric surgeries are done by laparoscopic surgeons.
Okay.
Now, for cosmetic surgeries, what they usually do is liposuction, tummy tuck, excessive skin reduction, those things. So they only work on a specific part of your body. So it's called a thing called spot reduction.
Okay.
Like if you want to remove only the tummy fat, you're fine with your overall appearance, then you go for a cosmetic surgery by a plastic surgeon. These are not life-saving surgeries. Okay, these are done to look better.
Purely cosmetic.
Cosmetic. Yeah.
Mm-hmm.
The bariatric surgeries are not cosmetic surgeries. They are life-improving surgeries. Okay, so what we do is we reduce the size of your stomach, or sometimes we bypass the intestines to make metabolic changes in your body. So these are called, that's why these are also called metabolic surgeries. So it helps reduce fat from all over the body. So even your cheeks, your neck, your tummy, thighs, hips, even the internal fat, the fat around your liver, intestines, which is called visceral fat. That also reduces with these bariatric surgeries. So when you get reduction of all this fat, it also helps your joints to bear less pressure on them. It improves your cardiopulmonary function. Your heart and lung doesn't have to work a lot to carry to make you move. So this improves your lifestyle. And statistically, it also reduces risk of cancer when you have less fat. So this is done to improve your quality of life, to increase your life expectancy. So these two are different things. Now here, there is no spot reduction. If you ask me that I specifically want to reduce my tummy, bariatric surgery wouldn't have. Then you better go for a cosmetic. But yeah, if you want to improve your lifestyle because of excess weight, if you want to lose overall fat, these surgery are very helpful.
What's the success rate in bariatric surgery? Is it like, are there some places where people can get complications, or is just the success rate is always...
Success is a bit different from complications. Like success, we measure in terms of your weight loss and reduction of comorbidities. Okay. So I would say success rate is about 90 to 95%.
Wow.
Yeah, we do get 5 to 10% of patients who may not lose enough weight, or they may regain weight even after the surgery over the next 2-3 years. So that can happen with 5 to 10%, but that is again a multifactorial thing. Like it can be from our side that surgery is not done very nicely. It can be on patient side that they don't stick to the diet plan, they don't do exercises, or our biggest enemy, alcohol. If the patients go back to alcohol or a lot of sugary foods, a lot of these fast foods, you may regain the weight. So success rate, we achieve in 90 to 95% of patients. Complications are a different thing. Complications, you may sometimes get some bleeding inside your tummy. Sometimes you may get some leaks. But the rates of these complications are around 2%.
Okay.
I would
very
say,
rare.
Yeah. So, but yeah, when you do about 100-150 cases, you may get 2 or 3 patients who may get some complications. But we do manage them. Okay. It's extremely rare to lose someone because of this surgery. But overall, they are safe surgeries.
Okay. And then another question, and it might come off like as a silly question, but trust me, just Kenya in general, people say Kenya is a drinking nation, because like that's the one entertainment thing that everybody, not everybody, sorry, like a lot of people definitely engage in during the weekend. How does alcohol factor, just affect this weight process thing?
Now, that reminds me, same answer which I have got from multiple patients. Like when a patient comes in to our clinic and when we take their history, I ask whether, do you drink? And many times I got an answer, I am a Kenyan. So that implies that I am drinking.
Automatically, yeah.
So it's taken as a proud, but it affects your overall health. Now, alcohol gets absorbed very fast from your body. I mean, from your stomach, and it enters your body very fast.
Mm.
Also, alcohol doesn't have any nutrients. It's an empty calories. So those empty calories get converted into fat and it gets accumulated in your body.
Okay.
Other effects of alcohol is it irritates your stomach. It can give you gastritis. It irritates your food pipe. It can give you acid reflux issue. It affects your liver and pancreas. Someone can lead to liver failure if they drink a lot of time. It can lead to pancreatitis, and it can also lead to some cancers, gastrointestinal cancers, even breast cancers. They can be caused by alcohol. So it's always best to stay away from alcohol. But even if you can't stay away, it should be occasional. Like
just minimize it.
Minimize it.
Oh, okay, interesting. Because I think that's also like one of the questions you asked me when I was coming for consultation. And it's funny enough because off my notes again, when I bumped into you into Westgate, I don't know whether you noticed what I was carrying.
No, I didn't know.
Because it hit me now later on when I'm getting into the car. It's like, I told him I don't drink, but what I'm carrying was alcohol, but not alcohol for drinking. It was like wine rice that can only be bought like at that specific location. So I was just like, oh, maybe now he'll just start thinking that, But then again, I have to tap into, remember like, this is a doctor. He deals with so many different interesting cases. He's probably not even paying attention to that. But that was just me like now just wondering like, what is even thinking about me? Okay, now another thing about like just weight loss. Another thing that's very popularized currently is Ozempic.
Yes.
So now I don't know if you have any opinions on that personally, because you deal with like now bariatric surgery, and other people are leaning towards. In fact, on mainstream a lot, what people know is Ozempic.
Yeah.
So what's your opinion on that? Or take?
I'm a bit neutral about Ozempic. Like if you want to try it, definitely it can be tried. Now, it always depends upon what your personal goals are. Like someone doesn't want to undergo a surgery. They want minimal invasive things. So for them, Ozempic would work well. Now, statistically, if you see, Ozempic gives you weight loss about 10 to 15% of your body weight. Okay. So if you're a 100 kg guy, you may lose about 10 to 15 kg of weight. If that is your goal, perfectly fine. You can go with Ozempic. Okay. But if your goal is to come into your 70s, if you want to lose 30-40% of your body weight, that's not going to get achieved with Ozempic. For that, you need bariatric surgeries. Like with sleeve gastrectomy, you may lose about 30% of your body weight. On average, some people may go up to 40% also. With gastric bypasses, you lose about 40% of your body weight. So it always depends upon your goal, your other comorbidities like correction of your diabetes, reflux issue. Those things would be better with a gastric bypass rather than Ozempic. Ozempic also has these side effects like gastrointestinal disturbance. So there are a lot of people who would not be able to stick with Ozempic more than 2-3 months. Eventually they get fed up and they can't continue it anymore. But you need to take them for at least a year to see those results. Another thing is it's a new thing, like it's been in American market for last 6-7 years as obesity medicines, and in Kenya it's only there for last around 2 years. And so we don't know the long-term effects. But that's how you get to know about all the medicines. So it's okay. If someone's goal is about 10-15% of weight loss, they don't want to undergo any procedure, I would say, yes, Ozempic can be fine for you.
Okay, so definitely bariatric surgery is more effective when you're trying to actually...
Yes, not just for the effective for weight loss, also cost effective, I would say.
Oh, really?
Yeah.
Okay, I've heard Ozempic is expensive, right?
Yeah, it's expensive. Like if you see your 1 year Ozempic dose, it becomes as good as a bariatric surgery or maybe a little bit more than that.
Yeah.
I would say 10% here and there. But amount of weight loss and the relief from comorbidities that you get from bariatric surgery is much more compared to Ozempic. So that is why I consider bariatric surgery is more cost effective. Okay. But again, it's always a personal choice. So we don't force anyone about it.
And then just another one to finalize on that, because again, I also have just to touch on Ozempic, because trust me, on TikTok and Instagram, it's all over the place, even on
Yes.
YouTube. Does this mean if, let's say, you've done it for like 6 months, and then let's say you run out of a budget of just making sure you buy the meds consistently, will that mean like your weight loss journey is affected and you might start gaining back weight? I don't know.
Now, it's hard to believe that you run out of money, because we always be clear that this is the cost. So unless you have that budget, don't start on it. So it's always better to ask your doctor that what will be the total cost over the long run. Okay, you should not end up midway.
True.
Yeah, but you may have some weight loss in 6 months, but it won't be desired weight loss. And if you stop, chances of regain will always be there. But we are yet to see long-term results, like what happens after 1 or 2 years, whether you regain or no. For bariatric surgeries, it's been there for 60, 70 years. Laparoscopic bariatric surgery.
60, 70 years.
Yeah. Laparoscopic surgeries, they've been there for more than 35 years. I mean, around 35 years. It's been there. So we know the long-term results, the failure rate. That's why I'm saying we have about 10% patients who regain weight in the long run. For Ozempic, we don't know the exact data.
Okay, that's actually interesting. And, it's always good to know like just extra information before you get yourself into like such a situation. Okay, and then also like just for bariatric surgery, right? Like what are some of like just even the myths and fears around it?
First fear
that you've heard from, like, let's say patients when they're coming, this is
Yes.
like their major concern.
Yeah, most major concern, everybody thinks whether I'll survive this surgery or no. But you will definitely survive the surgery. The other major concerns for them are they are fearing that they won't be able to eat a lot. They fear about the complications of these surgeries, like bleeding, the leaks, food leaking out in your tummy. They are worried about it because everybody do some Googling and then they come to the
That's the
clinic.
worst thing, yeah.
Yeah, so they have a lot of fear regarding this. So all we do is counsel them. We show them statistics that these are the statistics. It doesn't happen with everyone. Although we don't know which category you're gonna fall in, but statistically chances are minimal.
Okay, and then another thing is what lifestyle changes do the patients need to like actually incorporate in their life after such a procedure? Because it's also,
that's
I
the
think
most important thing. I always tell the patients that surgery is only the half part. Okay, the remaining half part is after surgery care.
Okay,
like it's not like that once we have done surgery, everything is done and now you can go on eat everything. You need to be good at your choices. You need to be eating a lot of protein rich food, less of refined sugars and less fats, more fibers.
Okay.
So we give a typical diet plan for up to 6 months. You need to stay away from all the sugary desserts, sodas, alcohol. And you also need to do some weight trainings, like you need to build up your muscles. Now when we do surgery, naturally along with fat, body will burn a bit of muscles as well. We don't want that. We want you to preserve your muscles.
Okay.
So you need to eat this protein rich food and do some strength training. So it not only reduces you in size, it also changes your shape and your overall strength and health.
And does it matter like if your protein intake is plant-based or like animal-based?
That doesn't matter. I mean,
really?
Yeah, animal-based protein is also fine. It's a personal choice. Some people are vegan, so they would like plant-based proteins. If you are a carnivore and if you want animal-based protein, that's completely fine. But the thing is, when you take animal-based protein, it itself has a bit of fat inside your protein. So it's always good to make a right choice there. Don't go for fried meats. Better go for roasted or boiled meats, shallow fried, something like that. Not deep fried chicken to get your protein.
Okay.